Good afternoon, everybody. Welcome. Kat and I are delighted to be able to present this webinar to you, and we are very delighted that we've got over 130 participants registered. So I do hope that you get your particular need around risk management addressed in this forum. We do have a whole range of resources available on the VMIA website, and you can see the VMIA web address on your on the slide set. There are a lot of risk-related resources, not only just risk-related resources, but most of what we are talking about today comes out of a publication on the website called the VMIA Risk Practice Guide. And so we will draw your attention to that as we go through today's presentation. I think Kat is back on air. Yes, Kat?
I'm so sorry, everything just froze and then shut down. So that was fun, but I'm back and hopefully we won't have any further problems.
Yeah.
Before we commence, I just wanted to also acknowledge the country on which we are all on today. I'm speaking to you from Bunurong and Wurundjeri land, and John is speaking to us on Wurundjeri land, and I pay my respects to elders past, present and emerging, and I'd like to extend that respect to other First Nations people who are online today and the traditional owners of the land that you're all on while tuning in today as well. Can we go to the next slide please, Bronwyn? So we are hoping to cover quite a lot of content today, and we do want to leave some time to take questions from you all too. We'll be going through a few sections. So we'll be starting with our key risk concepts, what they mean, and other things around risk management standards and principles as well. I'm sure that will be a refresher for quite a few of you, but we find it's really important to establish that shared language as well. Then we'll go through a standard risk management framework, what that looks like, what it contains, and the governance around that as well. And then we'll spend some time talking about strategic risk, decision making as well, particularly in relation to the risk process. So that would include identifying and articulating risks, and what sorts of things we should be recording in a risk register, and in particular a strategic risk register as well. We will stop for a quick 5-minute break about halfway through. There is a lot of information in today's session, and it really gives everyone a chance to digest the information, think about what it means for you in your context, and then also have a quick tea break as well. We will be, as I said, leaving a few minutes at the end for your questions, and so please just make sure that you pop them into Slido. But if for whatever reason you are having trouble with Slido, you can also feel free to unmute yourself at the end of the session and ask us a question too. We'd love to hear from you. Next slide, please. So today we'd like to start by asking you, what does risk and risk management mean to you and your family, and how is that different to what it means for you for your work role in your organisation as well? If you feel comfortable sharing, we'd love to hear from you if you want to put any comments or suggestions about what risk and risk management means to you in the chat. You can see the image on screen is of a can of worms, and we find that people feel like exploring and identifying risk is like opening a can of worms, and sometimes people don't enjoy discussing risk, particularly in professional contexts. And we also find that people can think about risk quite differently, from personal risk taking to kind of workplace risk taking as well. And when you're kind of thinking about your answers, I'm sure that you realize we all make decisions, and some unconsciously, about risk every day. In fact, we're really good at assessing our own risk and making those subconscious and conscious choices in relation to that. And we'll focus a lot on how we make these decisions and inform our risk taking today. Next slide, please, Bronwyn. Okay, so what do we mean when we talk about risk? It's clear that we are all well acquainted with managing risk here. Everyone does it intrinsically in our roles, and we'll just refresh on the definition of risk we're going to use today and really talk about what does that mean for us in practice in our organisations. So risk in this context means uncertainty, and how it can affect both negatively and positively our ability to achieve our objectives. And this is the official definition on screen in the International Risk Management Standard as well. And the real important thing here is uncertainty. And something that's known and has already happened is an issue or an incident that we may currently be managing. Whereas risk is something that's uncertain, it's not happened yet. It's looking at how we can best prepare ourselves to be resilient against future events or embrace the opportunities they may present. And another way to look at this is asking yourself, what is your organisation actually trying to do? And considering what's going to stop you from achieving that as well. And there really is no absolute certainty about the future. And there might be some levels of predictability, but it's the uncertainty about what could happen that really gives rise to risk. And so as uncertainty changes, so does the risk. And that shows us that risk is something that's dynamic and it has to be monitored and reviewed on a regular basis. And it's also important to think about that uncertainty in terms of opportunities and positives as well, because we quite often talk about risk in quite a negative way. But the real guiding principle of risk management is that it creates and protects value. So using good risk practice and behaviours frees us up to capitalise on opportunities and really create value for our organisation and its stakeholders as well. And because we're more prepared, we're more free to focus on the important things, and we're much less likely to get lost and make kind of rushed and uninformed decisions as well. Can we go to the next slide, please, Bronwyn? Thanks very much. So when we're actually talking about risk management or the management of risk, we're referring to your coordinated activities that you do to control risk in your organisation. You can have both informal and formal risk management as well. And we're all pretty good at informal risk management. So there would be no documented risk assessment process, but the risk would be considered and some action might be taken. And we might do this during kind of our day-to-day activities where there might be some uncertainty that can affect what we would like to do in our organisation. But formal risk management is a coordinated approach where the steps of the risk management process are followed and they're applied as well. And that will result in the risk being recorded, it would be actioned with an owner, it would have timeframes and reported and monitored on as well. And we find that organisations who really embrace risk management and understand that it should be placed as kind of a legitimate business activity along with things like accounting and recruitment and your training as well, they tend to be able to make better decisions and are much more confident to achieve their objectives as well. Next slide, please. And most of the organisations online today, you'll actually have obligations regarding risk management as well. It's not just a nice to have. It's something that's really fundamental to our business, and we need to comply with various regulatory standards and frameworks as well. And it's also important when thinking about compliance to think about why we have to comply. And ultimately, it's to create and protect the value of what your organisation does for your stakeholders. And so the things we'll be sharing today, they'll help you comply with the risk management standard, the International Standard 31000. That's the second bullet point that you can see on screen there. And that's the basis for many of our obligations around risk management. And so in relation to any community organisations online today, we understand that your service agreements include a clause on risk management against the ISO 31000. And risk management is also a key pillar of the Community Services Quality Governance Framework as well. And in the case of health services, they would have to attest to the Victorian Government Risk Management Framework, or the VGRMF, which also references the ISO 31000. And just to note that the VGRMF has actually been revised and a new version will be coming out later in this year, and that still does reference the international standard as well. I'm going to hand over to John now, who's going to take us through more on decision-making, governance and risk management frameworks. But please let us know if you have any questions on any of the kind of concepts or definitions of risks that we can talk about later.
Thanks, Kat. Next slide. Thank you, Bronwyn. So people may be familiar with this term, VUCA. We're clearly living in a VUCA world at the moment, and V is for volatile, and U is for uncertain, C complex, and A ambiguous. And so a major theme for this webinar is that decisions frequently involve risk, and they're usually associated with the achievement of objectives of some sort, which Kat has already referred to. And often we make decisions based on incomplete information or where there is some uncertainty around what the outcome is going to be. So it's evident that risk-based decisions are about making the best informed decision we can with the information we have available. Meaning we need to take into account the uncertainties of our potential choices and the actions and consider those before we make a decision. And as Kat said, risk doesn't always have to be negative, and risk-based decision-making can be applied to take advantage of an opportunity by exploring possibilities and managing the uncertainties with the aim of a positive outcome. And I'm reminded that several agencies, with the advent of the NDIS, have in fact taken advantage of that initiative by the Commonwealth, and some of them are brokers of NDIS services in the planning context, and some of them are service providers. And so there were obviously risks associated with a new initiative that was really a wholesale review of some of the services that used to be provided through the HAC program. And lots of agencies have taken the bull by the horn, so to speak, and taken advantage of that new service environment. So for an organisation, it's about what my organisation is trying to achieve. So the objectives, as we've said, what could hinder my organisation from achieving those objectives? What can I do in my role to prevent this, or indeed to take advantage of it? And so a rhetorical question for the participants, how does your agency obtain enough information to make its decisions? And what conduits does it use to obtain reliable information? And as we've talked about, risk-based decision is making the best use of available information at the time. So we would argue that it's really important that an organisation has a range of methods by which it obtains information that presents issues or challenges to its remit. Next slide, please, Bronwyn. So, why risk management? Well, there is a lot of evidence now about the efficacy of good risk-based decision-making, just as there is a lot of evidence about failures that are related to things like poor risk culture or not being rigorous about the management of risks. And so it's all about decision-making that allows us to take measured risk. It often results in improved outcomes for our service recipients and key stakeholders. It certainly makes accountability for risk-based decisions much clearer. It gives boards and executives increased confidence. And as we've said, it does identify opportunities. So another rhetorical question from me to the participants: does your agency actually have a culture of applying the risk process? And we're going to talk about what constitutes the risk process shortly, to address complex problems and/or uncertainty. How does your agency make decisions in a VUCA world? Next slide, please. So Kat's already mentioned that the ISO standard contains these 8 principles, but the central reason for why you would engage with risk management is to create the value and protect the value of your agency to its key stakeholders, including the clients, and both actual and potential clients, staff, government, funders, and indeed the wider community. That's why you do risk management. to create the value and protect the value of your agencies. And when applied consistently, risk management improves performance, it encourages innovation and accountability, and it supports the achievement of your objectives. Next slide, please, Bronwyn. So we can't talk about risk management without talking about culture. And indeed, we can't talk about culture without looking at risk culture as a subset of organisational culture. And the health literature is replete with examples of failures of agencies, which are most often related to, shall we say, a substandard culture and poor expectations and poor attitudes and behaviours in relation to the taking of risks. And so it's important that risk culture is viewed as a part of an overall organisational culture and not separate. And the dimensions of safety culture in the human services domain is really important, and it requires its own focus. So if an organisation treats employees harshly, unfairly reprimanded for mistakes, etc., that's going to have an impact on how comfortable employees are in raising issues and reporting risks. If there's no conduit through which clients can provide feedback, for example, that is also symptomatic of a suboptimal culture. Conversely, where there's a positive attitude to risk identification, active participation in decision-making, ownership and accountability, and communications transparent, then an organisation increases its ability to achieve its objectives and deal with issues proactively, pardon me, and also when they arise. So there are three components of what we would term a positive risk culture. Accountability. So there obviously needs to be accountability for owning and managing risks, and the board and audit committee has a role to play in ensuring that this occurs with oversight. Awareness. Risk is often, and risk management is also about change, and unless change occurs constructively and transparently and people are aware, there needs to be an awareness of risk in relation to managing change. And often change requires active endorsement and explanation of the rationale for change, and the board in this context and the executive have a really important role about conveying expectations. And that is usually communicated through a risk strategy, a policy, formal meetings and informal discussions, application of a process, which we'll talk about, manifest in position descriptions and performance reviews, orientation and induction programs, and the list goes on. And of course, attitudes linked to the values and behaviours of an agency, and these can be measured and included as part of performance. It's also possible to have an integrity framework in place so people know how they have to behave and monitor, and this is important when you're orientating new staff and you're conducting performance reviews. And all of those things manifest in behaviours. And so boards and executives who occupy roles of authority and influence need to demonstrate their mandate and their commitment to the management of risk. Thanks, Bronwyn. Next slide. So my question to you to take a minute is, how can you as directors and managers and indeed frontline staff foster the development of a positive safety and risk culture in your agencies? And how might you evidence this? Food for thought. Moving on, please, Bronwyn. The risk management framework. This slide is a diagrammatic representation of the elements in a risk management framework. And that consists typically of governance arrangements, obviously a board and board subcommittees, and instruments, if you like, a risk management policy, a formal position that it takes on how risk will be managed in that agency, a strategy, how risk management will be rolled out if it's a new agency, or indeed improved in relation to an assessment of maturity, for instance, risk appetite, a technical aspect of managing risk, and I could spend all day talking about risk appetite to you, but we don't have time. But essentially, how much risk a board and executives are willing to take in pursuit of its strategic objectives. And of course, we've just talked about culture. There's clearly a process, and the process is relatively generic, and Kat's going to talk a bit more about the elements of the process, and of course resources. And the relationship between risk management and strategic objectives is really important, and we've tried to depict that here in this diagram. And so the level at which objectives are first articulated in most agencies is at the strategic level by the board with input from the executive. And we would suggest that if an agency hasn't actually identified risks to its strategic objectives, no matter how big you are or what your remit is, that's probably a significant gap in your risk profile of your agency. So, a couple of points here. Competent and efficient governance is necessary for risk management to be effective in managing risks to a satisfactory level. Explicit policy statements, and by that I mean the board should take a position about which activities in the agency it requires a formal application of the risk management process. Strategy, procurement, projects above a certain dollar value, and the list goes on. The level of resourcing to manage risk needs to match the agency's risk profile. And when I talk about risk profile, I'm talking about more than just the risks that are sitting on your risk register. The risk profile includes things that may not be immediately visible to the agency, things that are happening in the external environment that have a material impact on the agency achieving its objectives. And the board and senior management do need to identify, understand, and manage strategic risk. And of course, a positive risk culture promoting acceptable and appropriate risk-taking behaviours. I think that's it for that, Bronwyn. Next slide, please. So this diagram is trying to give you an overview of the governance arrangements, if you like, in a single slide, looking at the volume of risk management information or risk information being generated down at the business unit level or the department or the service level. And that requires obviously an operational risk response managed by each business unit. And the people who are closest to where the risks arise are the people who should be managing the treatment of those risks. And then the executive, obviously overseeing the operational risk management at their level and providing strategic risk information. And they obviously receive information from the shop floor, as it were. And then the board, the ultimate governing body that is accountable indeed to the minister for the satisfactory management of risk, and indeed in some cases escalation of risks to the minister. So they're looking at strategic and extreme operational risks, and obviously they do that in conjunction with their executive. and through the Audit and Risk Committee at the board level, quality and governance committees, for instance, clinical governance committees if you're a health service provider, are the formal conduits through which risk is made transparent. Next slide, please, Bronwyn. It's important, I think, to talk about risk ownership and risk management. I've just talked about the risk manager ideally being the person or the group of people who are closest to where risks arise, but typically the risk owner is the person who will be responsible for managing and making sure that risk management is undertaken properly and resourced appropriately, and that that person is in a position to give the board assurance through the CEO usually that risks are under control. So risk ownership is really important, as is the ownership of controls, which I'll talk about shortly. Next slide, please. A break. How are we going?
Did you want to have a break or did you want to carry on? There's quite, I was thinking there's quite a few questions that have already come through in Slido. So I think it would be wonderful if we could leave enough time to really get into those at the end of the session. So I'm more than happy to carry on because we're moving quite fast. What do you think, John?
Yes, by all means.
Okay, brilliant. We'll carry on.
Next slide, please, Bronwyn. Kat talked about the fact that we make decisions about risk every day of the week, informally and often unconsciously or subconsciously. And so we thought we'd just try to give you a taste of what your personal risk appetite might look like. So imagine for a moment, if you will, that you're on a plane at 30,000 feet and I ask you to jump out. Would you? The plane has 2 engines and one's on fire. Would you jump out now? It's a bit odd talking about flights now when we're all in lockdown, but just humour me, won't you? So one engine's on fire. You have a World War II parachute and you've had no training on how to use it. Would you jump out now? You notice still that the engine's still on fire. You have that World War II parachute. You have had extensive training on how to use it and you've packed it yourself. Would you jump out now? So the point about doing this little deviation, as it were, is that we all have different appetites for risks, risk types and levels of risk in our lives and our businesses. Ultimately, risk management and deciding on how far you're going to take a course of action necessarily involves information, good information, but it also results in trade-offs. There are always trade-offs in relation to how you're going to manage a risk. And even for agencies that have the luxury of, dedicated risk management units, like big tertiary teaching hospitals, for instance, to the very small agencies that don't have the luxury of those resources, there are always trade-offs. And so if you're thinking about the extent to which you're going to deploy resources, the advantage of doing that in a systematic way through applying a process, which Kat is about to talk about, has enormous value. It makes the whole situation much more transparent. It gives you a methodology for identifying what you know and what you don't know. It makes the link between cause and effect really transparent and visible. And as I said before, there are things that happen in agencies where the board and the executive should formally apply the process that Kat's about to talk about. And we recommend that the value that you derive from doing that is a really good investment. Next slide, please.
Okay, so just before I actually talk about the risk process, I just realised because my internet dropped out at the beginning, I didn't get a chance to say that we know it's an incredibly difficult time for everyone, especially your sector. And while we may be within a current context of a crisis and we're managing in our day-to-day work, looking at things like business continuity and emergency management, and we'd be focusing on our more extreme operational risks that can happen at a time like this, we are keeping a focus on risk management and particularly strategic risk management today, because we find that this can really help us make well-informed and resilient decisions in those situations of uncertainty. And we are really happy to have broader discussions today and take your more specific questions at the end of the session, but that's why we're keeping this focus at the strategic level at the moment. So the risk management process on screen is from the international standard, and that's what involves the systematic application of your policies and your procedures and your practices. And it is more than just a risk assessment. There's a lot that goes into informing and monitoring our assessments of risk. So this process should be an integral part of our management and decision making, and ideally would be integrated into the structure and operations of our organisations as well. It can be applied at the strategic level, but also at your operational and project levels as well. So bear that in mind as you go through examples of your own today. So I'll just begin by quickly talking about the section in the middle in blue. So we'd start by kind of looking at our context. We need to know, what are we trying to achieve and where are we at currently? And then we'd begin our risk assessment, which is where we'd start to identify the risks, the events or circumstances that might affect our achievement of our objectives. And then we'd get into our risk analysis. So that's where we'd find our deeper understanding of those causes and consequences as well. And we'd look at what we're doing to currently manage the risk. And then we'd get into our risk evaluation. We'd think about how likely are these events to occur and do we need to treat them? And then we think about what can we do to manage these risks if we need to treat it in our risk treatments, and what actions can we take to respond. And then we have the circular arrows around the outside, and those are the things that we need to continually do throughout the process. They're really essential to inform and track the assessment that's described in blue in the middle. And we're going to broadly go through the key areas of this process in the rest of this workshop, talk about some tools and ideas that you can take back to your own organisation to help you manage risk and align to this process as well. And next slide, please, Bronwyn. Okay, so when we begin to think about our risk conversations, what do we need, who do we need to talk to, and how are we going to do that? So this diagram relates to examining our stakeholders and their level of influence. So the reason we've included this is because managing risk is actually a really political process. And that's where your capacity to successfully persuade and influence others can be really critical. And relying on evidence alone sometimes isn't sufficient, because we all have cognitive biases, and that can influence our thoughts and opinions when it comes to risk. And the more uncertain we are, the more we're going to rely on our habits and biases in terms of how we make decisions and solve problems. So going through that risk process really helps slow down our decision making, so we can interrogate our thinking and the information that we have access to make better informed decisions. And so there are risks related to stakeholders, and we should assess our stakeholders in relation to their level of influence, and that would then contribute to our risk intelligence. And so we'd recommend that a stakeholder management plan should be developed for your high and extreme rated risks at a minimum, or the stakeholder relationships that you intuitively know need really close management. So for example, your regulators and your funders as well. And ultimately our decisions should really be informed by those people who are directly affected by the issue, those who might be technical experts, or those who might be in positions of authority that can influence both the process and the outcome as well. And this can be a really good starting point for assessing your scope and context in that risk management process in the previous slide. Next slide, please, Bronwyn. So a PESTLE is another tool to help us establish our external context. Some of you may use a SWOT analysis, which can also be really useful. A SWOT does tend to be a bit more internal focused and much more subjective than a PESTLE. So you may want to do both. In this example on screen, we have added in an extra category on the end, particularly for your sector group, because we know that clinical risk is a really important consideration for you. But with the PESTLE, under each area identified on screen, we want to think about what can affect us and our ability to achieve our objectives in that area. And then once we've identified those things, we need to look at whether they can impact us either positively or negatively or both. So I encourage you to have a think about how much your agency knows about what might be coming towards you in the future. We may be managing things right now, but what about what could be next, what's coming towards us? And thinking about what role does your board play in really identifying those out of sight aspects? Do they just get information from reports, or do they really interrogate and validate that information and have their own conduits for information as well? Next slide, please, Bronwyn. So the management of risk, as we've been talking about, is always future facing. And from all the possibilities that might happen, our organisations have to decide which uncertainty poses the biggest threat and which potentially delivers us the greatest opportunity. And not all uncertainty can or should be managed. And one element of really good risk management is deciding where should we focus our effort and resources that add and protect value. And those environmental scans that we just talked about can really help us build a picture of our risk universe. So when you're considering your risk universe, like the one on screen, just wondering if you include consideration of the risk areas you can see on the slide. We find these commonly affect health and community services. Are there any additional ones that you include that are missing on this slide? One that we're seeing an increased focus on is shared risk. It's actually called interagency relationship management on this slide, but that's a little bit outdated language now. We really mean shared risk. So that's when we collaborate with other agencies and our partnerships, and asking ourselves, can we identify not only what are the risks that's common to all of us, but what risks do we actually share that we're both accountable and responsible for and that we have to manage together? And are there clear processes for risk escalation across boundaries as well? And our cyber risks are increasingly important as well. We know that 65% of worldwide cyber breaches actually involve medical or patient data theft. And we all know about the recent cyber attacks in certain regions of Victoria's healthcare services. And so it's really important to consider cyber risk in our risk universes. And due to our current environment, we might add one in to our risk universe around a pandemic. So knowing and regularly assessing your risk universe helps to bring uncertainty into view, and it helps us to know what we need to manage as well. Next slide, please, Bronwyn. Okay, so we've talked about our current context and what our organisation's overall risk universe can look like, but what about our strategic versus our operational risks? Where does that come in? So John definitely touched on that earlier. In most organisations, objectives are usually articulated first at our strategic level. So even though risks occur at all levels of an organisation, we need to begin our risk thinking when we set our strategy. So this slide depicts the link between strategic risks and then the flow on of operational risks that arise when we write and implement our business plans. And so we know in real life, the process is not as clean and linear as it is on screen, and there's a lot more kind of flows of information that go backward and forward, but ultimately the board have a really important role for setting strategy, and so they should have involvement in identifying the risk to your strategic objectives. They should be thinking about your risk universe. They should also have the visibility of your strategic risks and also how they're being managed as well. And just as strategy informs your business plan, so do your strategic risks. And we really identify our risks to strategy because it helps us to achieve our objectives. We've really thought about the uncertainty that lies ahead, and then we put strategies in place to manage it. So our decisions have become more defendable because they're well informed and they are based on the best available information. John, do you have any examples that you might want to share about strategic and operational risk? You're on mute, just FYI.
Thanks, Kat. Well, the most obvious one, because I do a lot of work with rural hospitals, is a lot of boards of rural hospitals are questioning the continuance of providing maternity care, for instance, because, as everyone knows, obstetric care is high risk, pardon me, and there are a whole range of issues and factors that confront small rural health services in relation to providing maternity care. I know of at least 2 hospitals that have decided to either stop providing maternity services because the risks are such that they can't, it's preferable for them to stop that as a service offering, or other hospitals who actually have been, have chosen to downgrade their, the level at which they operate in relation to the maternity services capability framework for all Victorian hospitals. And they've arrived at those decisions through a very explicit process of risk identification, assessment of controls and impacts. And so, yeah, that's a really tangible example about how a risk, a strategic direction has been influenced by the outcomes of applying a risk process.
Thanks, John. Okay, can we go to the next slide, please, Bronwyn? Thank you. Okay, so we've talked about our broader context, our strategy versus our operations and how they can influence each other, but how can we then begin to actually articulate our strategic risks? So there are lots of different ways to identify risk, and the international standard that we mentioned doesn't actually prescribe a single way. So the way that risks are identified will be specific to your organisation and to your context. But there are common kind of methods and sources around routine audits, incident reports, family and staff complaints, root cause analysis. And while we go through this, try to think about how are risks identified in your organisation and whether there may be any gaps in the policies and processes that you have for identifying risks as well. But we really find that the real challenge is actually determining what is material to your business. And that's where applying that risk process can help. We don't want a shopping list of risks of just everything that could possibly happen. We often see that in really long strategic risk registers. It's really about thinking what's likely, what's a priority for us and our overall success, and also what can we realistically actually manage within our locus of control as well. And how a risk is described will also influence how it's understood and addressed. And so articulating a risk has a knock-on effect for the rest of the risk process. And describing a risk can be challenging, especially at the strategic level. We find it can take several tries and a lot of discussion because there are so many impacts and considerations for your organisation's success. And we find breaking it down into the 3 elements on screen can really help. So we want to start by understanding the risk event, so it's the nature of what could happen. It's helpful to start by considering maybe one of your strategic objectives or a risk category that you have and think about what could go wrong for us here. And then we'd want to think about one of the events that we identified that could happen, and then we want to list the causes. So they might be current or potential issues that might lead to that happening. And then we would explore the potential impacts if the event took place. So one of the examples we see is when risk registers have one-word risks, and that really doesn't provide any help in managing or informing boards on risk. It's not useful, for example, just to write OH&S risk on a risk register. It's too broad, it's not specific, it's not clear what action you have to actually take or what you need to manage as an organisation. So whereas the risk of falling off a ladder is really specific, and the potential causes of the fall are easier to identify, as well as the impacts that can arise. But today we're going to try and think more at kind of our strategic levels. So Bronwyn, if we can go to the next slide. That risk description on screen is in that cause, event and impact approach. And we may be thinking about a particular objective in relation to this risk description, or maybe a risk category like governance and compliance, or something around fraud and corruption risk. And we've got that risk event listed first. We might be concerned about an undeclared conflict of interest happening. The causes we've listed next, about maybe our systems and processes are inadequate. And then the potential impacts. We may lose board members, we may suffer a loss of confidence, we can have increased regulatory scrutiny, potential litigation, or maybe negative media attention. But a clearly articulated and full risk statement like this, the ones in your organisations will probably be more specific. This is kind of quite a general one. But it puts your organisation in the best place to manage and treat them dynamically. And it is a lengthy statement. And so we find some organisations aren't comfortable with having that much text in their strategic risk registers. So you may capture just the risk event in one section, and then you would have the relevant causes and impacts as bullet points in other columns. You can find a way that works best for you, but what's important is to capture the causes and impacts of the risk. And that really helps you to identify where you have gaps and where you need to implement additional treatments as well. And to really arrive at a meaningful risk description like this, we recommend running a brainstorming session with the relevant people who work in the area, or others who can inform your understanding of the risk, and also with the board and executive as well. And so one of the methods that we recommend to get to a statement like this is using a bow tie tool. And some of you have probably seen this before. So Bronwyn, if we can go to the next slide. Thank you very much. This bow tie analysis is a really useful tool that can help organise your thoughts and unpack the risk a bit more. So we can get to understand and have clarity on what it is we're actually trying to prevent and manage. So we can see here, if we want to understand a risk event, we can then link it to the things that we think will cause it and the potential impacts. And then we can begin to put those causes and impacts that we've listed in this diagram into a risk statement like the one on the previous slide, and that can go in our risk register. And then once we've properly described our risk, that next step is to think about what are we already doing to manage this. And this is where describing the risk really has a flow-on effect for how we manage the risk. So rather than just listing every control our organisation might have for risks, we can begin to identify if we've got prevention controls that actually stop those particular causes occurring. Or we might have some recovery controls that help manage impacts if the event was to actually occur. And then we can identify where gaps may be, where we don't have anything in place, and that can then directly inform our action plan. So if I quickly think back to the bow tie, the risk statement, sorry, in the previous slide, I would have had my causes and my impacts listed on either side of the event. And I might notice that one of them that I identified may be one around negative media attention or adverse publicity. I don't have any controls there. So then I decide to take action and address that gap. And I may develop a treatment plan that involves things around an escalation process or a comms plan to respond to negative media attention. So by using that tool, I can better articulate the risk, but also directly link my controls and treatments to the causes and impacts they're meant to be managing. And we can share more on these materials after the workshop for you to take back to your organisation and actually work through as well. I'm going to hand over to John now, who's going to talk more about those really important controls for us.
Kat and Joanne, I'm just wondering whether now would be useful, because some people are leaving, whether we should be looking at some of these questions before the audience dissipates. Joanne, what do you think?
Happy to have some questions there. If you're wanting to take them at this point in time, that's absolutely fine.
Yes.
Okay, so I've been monitoring Slido as we go, and there have been a number of questions around risk management in the context of COVID-19 and the pandemic environment. And you commented earlier that this is perhaps one of the most uncertain environments that we've all been in, both from a professional and personal perspective. What are your thoughts on risk management in this kind of environment?
Do you want me to take it, Kat?
Go for it, John, yeah.
Well, I think the COVID environment is absolutely both a double-edged sword, but a marvellous opportunity to apply the process that we've just articulated up to now. And so COVID is probably what I would term the disruptor of the century. And the implications for business continuity are obvious. So I would look at COVID in relation to your current strategy, your current strategic objectives, your remit, and how your resource base is responding or will need to respond as the pandemic plays out. For instance, stage 4 restrictions have clearly escalated the intensity and the volatility of the situation. And so I don't know of a hospital board, as an example, because that's where I do most of my work, that hasn't sat down and had at least fortnightly, if not weekly meetings about the ongoing implications, both in operational terms and the medium to short-term future for their agencies. So if COVID and its implications aren't a hot topic of discussion at your board meetings or your executive meetings, and indeed your staff meetings, I'd have grave fears for the future of your business. So the processes and the things that we're talking about today in this presentation, even though they're high level, have direct application to you coming to an understanding of the nature of the risks and the nature of the uncertainties that have been precipitated and will continue to precipitate from this pandemic. So thinking about scenarios, to answer Kat's question about what could go wrong. Well, obviously there are things that have already gone wrong, but scenarios make people distinctly uncomfortable. Thinking about the worst case scenario does make people very uncomfortable, and that's where, when Kat referred to cognitive biases, that's where they come in. The old way, the historical way of solving problems and rising to issues may not be fit for purpose in this context. So people need to have open minds. They need to get reliable, validated information, trusted information in order to make informed decisions. Pardon me. Clearly, there's a whole different regulatory environment that we're in now with, the Chief Health Officer's edicts that are coming out, and there'll be more of those, no doubt. So, it's probably a good 2 or 3 days work, dedicated, focused, intense work to understand what your true risk profile is in relation to operating in a COVID-19 context. But you have to do it, no matter whether you're a small community service agency or a big teaching hospital or a TAFE or whatever you are.
John, another question just came through that's very relevant to your answer just then. Joanne, it didn't come through in Slido. Someone asked it in the questions function on Zoom, but I might just throw it to you and see if you have anything more to add, because I think it really speaks to what you just said. And so Chris McDonald wrote that most governments didn't actually anticipate the current pandemic, and most economists didn't anticipate the global financial crisis. So what does that say about the capacity of organisations, and in particular community organisations, to anticipate risk and then mitigate it?
Okay, I'm old enough to remember the advent of the SHERP in Victoria, the State Health Emergency Response Plan. There might be participants in the audience who remember that, and I think it still exists. So pandemics have been on the risk profile of agencies in terms of a business continuity challenge for at least 2 decades. And so what's different about COVID-19 is a lack of real, initially a lack of understanding about how it was transmitted, how it can mutate, and you know, the symptoms, whether you've got symptoms or you're asymptomatic, there's a whole range of different variables particular to this virus that needed to be understood and sorted out in order to provide the most efficacious response possible. But in terms of a public health emergency, the thinking around that in Victoria started at least 25 years ago, and that morphed into a thing called the SHERP. And so I think there's a lot of really valuable thinking that had already happened in the construction of the SHERP. And I think that it's probably worthwhile trying to get a copy of that and looking at that and seeing what elements of it are relevant to today and what gaps there might be for an agency in terms of its response.
Great, thank you.
I think an important factor that you raised earlier, John, too, is the risk culture of the organisation and the way they are practicing the management of risk in their normal board and operational environment, their normal strategic environment. There's always going to be risks that come, and as that viewer said earlier, you know, nobody thought 2020 was going to look like it does. We all had very different views of what we were planning to do this year, and pandemic has been a major disruptor. But we've had to keep that risk conversation live because the pandemic and the impact of the pandemic has constantly shifted as we've learnt more about it, as its impact and spread has increased. You know, Victoria is in a very different position to the rest of Australia. And if you've got that good understanding of risk management, if you've got that good understanding of cause, what you can control, how you manage and mitigate the risk within your own environment, I think that's the key, because exactly as Kat said, it's the uncertainty, it's something that we can't control, it's what we can control that's really important, and how we manage those elements that are in our control that's really critical for boards and organisations to be having the discussion about and taking on board. That's where that planning is critical.
I would agree, Joanne, and if I could be so bold as to suggest that there probably wasn't as robust a cultural mindset in the aged care sector for a whole lot of reasons, you know, for lack of funding and removing registered nurses from aged care, etc., etc. But you know, if a board and management aren't talking about these things, what are the material things that could make a difference to our existence, the way we do business, and to whom we do business with, and the services we provide? You know, that's the risk conversation that you should be having at every audit and risk committee.
Absolutely. I'm just going to remind people, because I know that a number of people came onto this session after we'd done our introduction, that we are asking questions via Slido. You can go Google Slido, jump onto the website, and our event code is 98078. Did you want to take one more question before resuming the presentation?
Sure. What's one of volume?
We've had a couple of questions around measuring a positive risk culture. How do you actually do that? What's the evidence that you do have a positive risk culture in the organisation? Because that basically forms the foundation for all of that risk response that we've been talking about in the recent discussion.
Good question. Look, I think there are a range of what I would call surrogate measures or proxy measures that you could legitimately use to, you know, measure a culture of responsibility and accountability. And, you know, the notion of duty of care can be extrapolated into a risk management context. And so when I think about, you know, what's the major thing that's, or the major attributes at an individual level that I find most informative, that tells me about a person's ethics or a person's sense of duty, is whether or not they understand their duty of care and how they express that in their everyday work, which is inclusive of, you know, do they walk over the rip in the carpet? Do they you know, leave the puddle on the floor? Do they not you know, make sure that, you know, the nurses who are going off duty at night time are sort of escorted to the car park, and on and on and on it goes. So to me, there are a whole lot of measures that are in the workplace that measure organisational culture. You might just have 2 or 3 specific things that are related to thinking about risk culture that you might add to a survey tool. And I'll take that one on notice, because I'm sure I could give the participants some suggestions about some simple measures, that outcome measures as well as process measures, that might answer that person's question.
John, just to add to that, we have got some risk culture materials that are going to be launched on our website, hopefully the beginning of September or at the end of August earliest. And they definitely speak to those kinds of things that you mentioned, John. So things around within your organisational culture, your risk culture is essentially assessing your organisation's attitudes towards risk management, really, and how you can have those kind of cultural identifiers like tone from the top. Is bad news escalated well? Is there transparency? And then using things like self-assessments, surveys and audits and interviews as well to kind of conduct that analysis and try and measure your risk culture that way. So there will be some resources, including kind of like a short health check tool that you can then actually take away and get some people to fill in as well in your organisation, that will hopefully help you. We'll definitely put a notification out when they've been launched on the website as well, so hopefully you'll all be informed when they go live, which is hopefully soon.
Thanks, Kat. I might let you continue with your presentation so that we've got a few minutes at the end for more questions.
Okay, all right. So I might skip through some of these things because I'm conscious that we've got 15 minutes left, but I do want to emphasise that a thing called the risk control framework is really important. And here are some examples of controls that are instituted. Most of these things you'll be familiar with. Most of these things are so-called business as usual things to control the potential for a risk event. Pardon me. And really, the controls can be existing or they can be new. They should be fit for purpose, and they once they're fully implemented in a treatment plan, they effectively become a control. So the difference there is you identify a gap in your controls and you treat that, and that's sort of a work in progress. And once it's fully implemented, it then becomes a control, and then it should be reassessed within 12 months to make a decision about whether it is working as it is intended. And that's an important thing to give an executive and a board a level of assurance about the efficacy of that particular control. So controls, obviously, going back to Kat's bow tie, controls influence how the risk is rated. The more controls, the stronger the controls, the more efficacious they are, the lower the risk rating. And so understanding the control is an essential part of your risk assessment. And we would advocate that every control, so every one of these blue boxes in slide in front of you has what we would call a control owner. So for instance, the HR manager might own the codes of conduct and the position descriptions. The education department, if you've got one, might own the supervision mentoring program. Legal counsel might own the legislative compliance framework, and so on and so forth. Next slide, please, Bronwyn. So, clearly, the design of a control is really important to make sure that it is fit for purpose. So, some questions here. Is the design meant to eliminate the risk altogether? My maternity services example is a case in point. Is it designed to change the likelihood or consequences? Is it meant to prevent something from happening? Is it meant to detect a breach, for instance, incompatibility warnings as an example in electronic medication prescribing software? Is it designed to correct an omission or an error, like spelling check errors, for instance? Or will it respond quickly and effectively? For instance, the installation of an emergency shower and eye wash stations if there's a chemical spill. So it's really important to make sure that the design is done in such a way that is actually going to make an impact on the cause. Next slide, please. And so, along with my theme about giving boards and executives assurance that things are working properly, there's a resource called the Control Effectiveness Framework, and we've got one on the website, which we'll draw your attention to. And this is a simple matrix. And so for every control that you identify in relation to limiting causes or limiting impact, you really should be conducting an assessment of the effectiveness of that control. And here's a 3-level matrix to help you come to a judgment about whether or not it's effective. Next slide, please. So, in risk parlance, this is called a heat map. It's just a matrix which identifies consequence and likelihood, and pardon me, and these should be described, consequences should be described in a table, and wherever possible, they should be based on evidence, professional advice, and or experience. Each level in the table needs to be clearly differentiated, and VMIA can provide advice on this. Likelihood of the risk event occurring, that is, should also be described in a table, and wherever possible, be based on historical experience where the outcomes are known. And so the use of probability modelling is quite sophisticated, and actuarial people do that, and I don't know that most agencies have got the resources to do that sophisticated probability modelling. So simple measures of likelihood is sufficient at this point. And so the intersection between likelihood and consequence provides you with your risk rating. And a tip to facilitate reporting, risk reporting, risks can be numbered and inserted into this heat map at the appropriate level, which makes a simple visual for a board to use, just as a tip. Next slide, please. Kat talked about the step of evaluation in the process, and so this is really about what are your options. So you've analysed, you've looked at consequences and likelihood, you've arrived at a risk rating, and so what are my options in terms of how I'm going to deal with this risk? Will I avoid the risk by deciding not to start something or continue with something, i.e. maternity services? Pardon me. Will I try and change something, i.e. the likelihood and the consequences? Will I retain the risk by an informed decision in order to pursue an opportunity, for instance? so I accept that risk and I maintain a watching brief over it? Or do I decide to share the risk with another party, a contractor, another agency, or indeed my insurer? A word of caution, not every risk is insurable. So before you decide to share a risk, you do need to check your insurance policies to make sure that the situation or the risk is not sitting in the list of exclusions. Next slide, please. So you've decided you're going to treat it. So why do we treat? So we treat to reduce the likelihood or the impact. And treatment describes the actions that we're going to take to modify the controls or to develop a new control. Another tip, try and avoid developing new controls unless you're absolutely satisfied that the existing controls aren't working, because you may just have a problem with compliance. Treatment identifies the resources to address that risk, and you should be determining what the target risk rating is if you anticipate that the controls that you're putting in place or the treatments you're putting in place will have their maximum effect. And of course, we've talked about responsibility and ownership for managing the risk, and you do need to define timeframes and reporting. Pardon me. So ultimately, you want to see the risk rating going down, which is the most useful outcome measure that demonstrates the effectiveness of the treatment that you've initiated. Next slide, please. Monitoring and review, really important. We have seen risk registers sit there without any scrutiny, without any change for years. So the higher the risk rating, the more closely it needs to be managed and monitored. So, risk information requires regular monitoring and review to ensure decisions are based on the best available information. The usual method of presenting risk information is in a risk report, and you can use some of the dot points in the slide above as headings in such a report. A copy of the extract from a risk register can also be attached, and this should be combined with a narrative. That narrative should give the board sufficient information that they feel assured that, one, the risk profile, the risk universe, to use the term in the slide that Kat presented, the risk profile is up to date and that the risk information put before them is accurate. Two, that material risks, and by materiality I mean they are game changers in terms of their potential impact on your objectives. The material risks are under control, that gaps in controls are actively being addressed. And three, I've talked about the higher the risk rating, the more closely it needs to be monitored and managed. Next slide, please. So this slide really includes those data items that we believe should feature as a minimum in a risk register, these 10 elements. They can be populated using summary information and hyperlink to other source documents such as risk treatment plans. You can also use simple dashboards with data extracted from the risk register to demonstrate trends that arise from the effective treatment of the risk. There are many risk register products available in the market, and I'm aware, for instance, that hospitals, I think, still have to use Riskman or VIMS, but if you're a small agency and you don't want to spend money on software or you can't afford it, you can look on our website and we've got a pretty good spreadsheet which is simple to use, and you can do the risk reporting from this. Next slide, please. Coming to the end. So, questions 1 and 2 in this slide are deliberately pitched at boards and senior management if you're in the participants. But slide 3 applies to all participants in this webinar. So, How comfortable are you that your agency has identified its strategic and operational key risks? Do you fully understand them? Are you satisfied they're controlled? Have you got the right information to give you insights into risks rather than just data? And are you getting that information in a timely way? Thirdly, what are your individual challenges or needs regarding risk management, and how will you address those? Food for thought. So, in summary, good risk management seeks to answer these questions. What are we trying to achieve? What events or circumstances could affect the achievement of our objectives? What are the consequences? How likely are these events? What can we do to manage these outcomes? How will we maximise opportunities? And lastly, how resilient is our agency if something does go wrong? Can the organisation recover if a risk eventuates? Joanne, that brings us to the last slide, please, Bronwyn. Last slide, please. So, Kat and I would like to thank you for your attention, and we'll open up to questions. Thank you, Joanne.
Thank you, John, and thank you, Kat. Okay, let's see if we've got some more questions in here. Someone's asked if you have some good tools in order to scope out risk assessment that you could recommend.
Yes, we do. Have a look on the website. And if that's not enough, you can email Kat and I, and we'll augment that with some examples in our toolkits.
Okay, thank you. Someone else has asked about risk-based decision making, and is that the same as evidence-based decision making? How would you describe a risk-based approach to making decisions?
Kat, do you want me to take that? Well, ideally, you collect evidence on which to make a judgment about a course of action. You might be looking at an options paper, for instance. You could go down path B or path A, and so you try and get some evidence or some opinion, professional opinion, about what is the most useful and efficient and efficacious way of handling a particular situation. So they're often called lines of inquiry. So you bring that information to bear and discuss it in a transparent context to come to a judgment about what you should do. And so you bring that information and you think about the extent to which it could have an impact on the risk event that you're trying to control, if that makes sense.
So I think something that's rather interesting in what we've talked about is the idea of a risk culture and risk being part of the way you do your business. So, you know, whilst we have lots of tools for risk registers, you know, you might have your risk appetite statements, you might have your risk mitigation. Those tools are of no value unless you've got that attitude and culture around risk, so it's part of your discussion at a board table, at the executive table, at the coalface. So whilst you might not be thinking, I'm having a risk management discussion, if you're asking those sorts of questions, exactly as you've said, John, if you're trying to understand what the risks are with that particular course of action, that decision, that direction that you're taking, how you're going to try and manage those risks, and what you're going to do if the worst thing happens, you're basically practicing risk management, even though you might not be aware of it.
Correct.
Yes.
And I think that's one of the challenges for a lot of people. We look at risk in a theoretical framework rather than thinking about it as being a general way we should be doing our business. And it's something that we should have in every discussion point, what are the risks associated with this? How are we going to manage them? What do we do if the worst happens? Rather than just that discussion that we have, exactly as you said, John, when you review your risk register or your risk management framework policy comes up for renewal. It should be the way you do business.
In my view, it's just as important as the management of the finances or the management of service delivery or the recruitment of staff. It's a discipline applied to, it's a method of solving problems, basically.
Yeah.
And you'll get a lot of utility out of it. The more you do it, the more familiar you become with methodologies, and the more reliable it becomes.
Yeah. And I suppose, one of the dangers is if we just think about risk management as the framework or the register, right, and not have it as part of our general discussion. And, I often hear from board members, I'm not very good at risk management. It's an area I don't know about. Well, actually, you're probably very good at it. And Kat said at the start about managing risk at home. That's something that we all do every day. It's just raising your consciousness of it so that it is something that you're thinking about as part of your general discussion. And for me, I think that's a really important message for board members and for executive to understand. It shouldn't be an agenda item. It should underline every agenda item.
Yep, agreed.
Okay, I think we've just about run out of time. I'd like to thank you so much for your presentation today, for the discussion. You can tell by the level of questions that we had and the engagement on the chat line how useful it was, and certainly very topical, as you said at the start, given we're in this current uncertain environment, which is, the core of risk in itself. So thank you very much for giving us your time so freely today. It's been a pro bono presentation and we really appreciate that.